Each week, we're asking experts questions about COVID-19 developments. This week, we're checking in with COVID-19 community coordinators about the efforts to get vaccine information to diverse communities around Minnesota. How are COVID-19 community coordinators helping Minnesota's diverse communities access the vaccine?
Our focus is to center community in our work. So that means prioritizing our focus communities, people who are high risk of being severely ill from COVID. Some of our strategy include connecting them with federal retail pharmacies, with our small local pharmacies as well, and also to some state sites that are the permanent sites that we have for testing and also for vaccination.
How are CCCs addressing language barriers?
There are staff that are dedicated to arranging for interpreter services in 20 or more languages, as well as for American Sign Language for the testing and vaccine sites. The governor's, any of his announcements are now being simultaneously translated in several languages. So I think overall, the question of language barriers is being addressed in so many different ways, and it's really great to see.
How do CCCs get feedback from communities?
Well, definitely the CCCs hold town halls, listening sessions. MDH also has a vaccine outreach program that has speakers, and so anyone in the community can ask to have a speaker, and generally it's an online event, and they ask questions, they give comments. So there are a number of different ways in which information is brought back so that it can be integrated into the planning that's being done.
What are some lessons learned a year into the pandemic?
I think one of the biggest lessons we've learned is that everyone needs to work outside of their silos. We are also recognizing the intersectionality of everyone. The CCCs, they recognize that there are BIPOC persons within the disability community, LGBTQ persons across all ethnicities. So we are cross-referring to each other and working in a very collaborative way. Working collaboratively with local public health, with community clinics, and with other community-based organizations. So not being so set in our ways that we can't open up our doors to other possibilities, I think is an important thing that we're recognizing more and more.